to the AI Shift podcast. Today, we are interviewing Dr. Rajeev Sharma.
Dr. Rajeev Sharma, can you please introduce yourself to the audience?
Sure. Hi, I'm Dr. Rajeev K. Sharma. I'm Chairman Orthopedics at Moolchand Medicity, New Delhi. We have been involved in arthroplasty, arthroscopies, and trauma surgeries.
Wow, that's really nice to hear. So, can you walk me through how AI has entered your day-to-day work over the last few years? And when did you first use an AI tool here at Moolchand?
Let me congratulate you first that you have chosen the right topic. The AI, artificial intelligence, probably is one of the most important subject today. There are lots of controversies, lots of expectations with the AI.
Yeah.
At Moolchand, we have been quite forthright in accepting the technology. We have accepted the robotic surgery in Moolchand, I think about 2 years back. And when we started with the CORI robot, and this was a very useful robot for knee replacements, partial knee replacements, and also hip replacements. It's a very promising subject.
Yes.
The AI is going to change the face of the orthopedics in time to come. In fact, it is already changing. In what way? Because earlier, as you know, that the knee joint replacement is actually the alignment with the natural anatomy of the patient and the right kind of the space creation to fix the implants within the joint. With the AI, the robotic help, we can have the exact assessment of the hip joint of the patient, ankle joint of the patient, and the knee joint, which in a conventional knee replacement surgery, you see only the knee joint. You're not able to see where the hip center is or where the ankle center is. That is why there are possibilities of committing a mistake.
So, I'm sorry to interrupt, but was there a moment you realized that this is actually changing how I work?
Well, robotic assistance is an important one, and when I realized, probably 2005, we started the first assistance of the artificial intelligence in the form of computer navigation. Computer navigation was a precursor of it was the technology which was based on the partly the AI assessment of the anatomy of the patient, and based on that the computer screen will guide us how to make the right kind of the cuts.
Wow.
Today's technology, the robotic assistance, is just not just one step but a few steps ahead of the earlier technology. And in this, you just have to, the computer or the artificial intelligence is not just telling you that where to make the cut, but it is actually making the cut for you.
Okay. But then there must be a very common fear among patients that if the robot doing a surgery and if the robot makes a mistake, then who's responsible for that mistake, and how do you prevent making such mistakes in the future?
That's a very interesting point that you are raising. Quite a few patients are very enthusiastic that they should get a help from the robot,
but some of them are
in
not
their surgery. But some of the patients are actually opposite to this. You know why they are opposite to this? Because they have seen in their families some surgery done with the robot,
yes,
and which has not been successful. So to be true, the robot is not doing the surgery.
Okay.
Robot is just assisting the surgeon.
Okay.
To do the surgery in the right assessments.
Right manner.
Because robot is only giving you the guidance. What you cannot see with the naked eye, The robot is giving you the assessment of that alignment.
But you're conducting the surgery.
But the surgery is done by the surgeon.
So you're supervising. So if the robot is you for making incisions, like because when humans, the hands shake when they try to go inside. So with the help of a robot, it's more steady and it's more efficient in trying to make better incisions and all.
Absolutely right. Because when the robot is giving you the assistance,
Yes.
you have the accurate cut of the bone.
Yes.
You are able to shape the bone
Exactly.
in the right alignment, which with the conventional instrumentation is not possible. But just taking ahead your question, the some patients are not are afraid of
Yes.
the point that maybe robot can commit a mistake,
Exactly.
and that is true. So that is why it is the surgeon who has to control the robot,
Yes.
not the robot is controlling the surgeon.
Yes, yes.
Very right, yes.
So that brings me to my next question. Like when the CORI system came, like first of all, when did the CORI system get implemented in Moolchand, and what was the learning curve like? Like how long did it take you? How long were you actually comfortable operating with it, and how do you still keep your manual surgical skills sharp at the same time?
Yeah, you're right. The manual skills need to be sharpened, and one has to keep practicing in any way, because the most of the surgeries patients still will get it done without the robot. At Moolchand, we received the robotic arm about 2 years back.
2 years back, okay.
Regarding the learning curve, I see that since I have been using the computer navigation we have operated over 1,000 patients of knee replacement using the computer navigation, and we were the first to use the computer navigation in 2005. So for me, the learning curve was almost instant.
Insignificant.
Yes.
It was very short time.
It was almost like we could do the first knee itself in the right way, because we knew the technology. But even for a fresh surgeon,
Yes.
the learning curve will not be so high, because today's robotic technology is reasonably matured, and it gives you the reasonable good approach idea how to make the cuts and how to make the alignment of the joint. So today I don't think that this learning curve is really huge.
Yes.
Because of the advancement of the technology itself.
Okay.
But yes, one has to have a very right kind of the training, and before somebody can do the robotic surgery.
Yes.
I'm talking about the young surgeons.
Yes.
Probably it is very important that the surgeon has an experience of conventional instrumentation for at least 100 surgeries.
Okay, that's what
because otherwise his assessments and his directions to the robot will not be accurate, and that will give rise to the problems which you just mentioned, that some patients will remain afraid of robot being used on them. Yeah.
So as such an experienced doctor, like who you are, like were you instantly comfortable with the new system, or did you take time to become comfortable with it? And were you uncomfortable at first or something? Like what were you feeling when it first came in?
For me, the technology is like back of my hand, because we have been using it for years and years.
Yes.
And I think that that's how the approach has to be for every surgeon, because the technologies will keep changing. The new things will keep coming.
Yes.
And we have to keep following it. And interestingly, let me tell you, since we are talking about the robotic assistance, the augmented reality, that is also one of the technology which is in between the computer navigation and the robotic assistance, which actually is like with the QR codes on the instrumentation, the machine can read that QR code, positioning, and with through your eye, you can use the specs, which has you can see the position of the limb alignment.
Yes.
Make the cuts accordingly, and with this augmented reality also,
Yes.
you can do the surgery. But of course, the robotic is the more advanced version of it.
So this brings me to my next question. Joint replacement is all about alignment, obviously. Getting the implant is exactly the right position is very important. So how does CORI specifically change that? And what can you do now in terms of using the system than what was harder before?
You know, the joint replacement, especially the knee replacement,
Yes.
is the three things are very important.
Yes.
One is the alignment,
Yes.
because we all walk on our feet. So the hip, knee, and ankle, they have to be in one line. That is called the neutral alignment.
Okay.
The second part of the knee surgery is the stability. One can have a good aligned knee, but an unstable knee. So you need to provide the right kind of stability to the joint.
So CORI provides stability.
That's
to the
right.
joint.
That's
Okay.
right. And the third thing is that your whole surgery has to be done in the most aseptic conditions.
Can you explain what that means?
The aseptic conditions means the minimizing the chances of infection in the patient,
Okay.
right? Which is the foremost need of the surgery. So the CORI helps us, or the robotic assistance helps us in not just the alignment, but also the stability of the knee joint.
Okay.
Right.
So it's a very big. It's helping surgeries in a very big way. So could you say it's revolutionized the medical world, the implementation of the CORI system?
Well, definitely the revolution is there,
Yes.
and I'm sure that such revolutions in medical sciences
Yes.
will keep happening,
Keep happening.
from time to time. But as of today, where we are, probably the robotic assistance is the most advanced technology in our hands in the world.
So where do you see AI taking a field over the next 5 to 10 years? Like, as being such an experienced doctor, you always have an idea about what the current technology is, and can you predict as to which path the AI will take in the future and how it will look like? And like, will AI be doing surgery completely on their own? Will it become better than humans? Will humans not have to supervise it? So can you give a brief overview on that?
Yes, that's a very, very apt question. That AI is a boon, but AI can become a big trouble as well.
Yes.
So in future, we expect the artificial intelligence to help our surgeries even better.
In what ways?
In what ways? Today we are able to talk about the 0.5 millimeter assessments of our stability or the alignment. Maybe tomorrow we are talking sub 0.5 millimeter stability as well. The second part is that the AI will keep enhancing its knowledge.
Yes.
But will it ever be able to surpass the human brain?
Yes.
Well, that I don't think that will ever happen,
It'll never happen.
because the human brain is probably the smartest robot that the God has created, because there are so many ways that you can train your brain. I don't think that AI will ever be able to reach to that level. But for us as medical specialists, as much enhancement happens in the technology, and that keeps helping our patients having the improved results, faster recovery, and safer recovery. We are happy for that. So only the time will tell us that how much the AI is going to develop more and more, and how it is going to help us in various different aspects of our treatments. Yeah.
That's really interesting to know that the AI will never ever take the complete role of surgeons, but it will help in minimizing, like making it as efficient as possible in terms of doing surgeries. So this brings me to my last question. So what changes have you actually seen in patients in patient recovery since using CORI? Like, is there less swelling? Is there less pain? Is there less time consuming? Like, are they able to go back? Are they taking less time to go back to activity? Like, can you give me an overview on that?
Yes. I think that's again a very right question for today's time, because the patients. Let me take you back a little bit. There was a time, say 25, 28, 30 years back, when our patients were admitted in the hospital for a week.
Yes.
When I was in All India Institute of Medical Sciences, we would admit our patient for 1 week or 10 days after the knee replacement. And there will be a big preparation for the knee replacement surgery.
Yes.
This was at almost 32 years back. But today, we are able to discharge our patient on second day of the surgery or the third day of the surgery. We make the patient walk 2 hours after surgery.
Wow. 2 hours after surgery,
Yes.
they start walking.
And the patient walk within the room. Next day of the surgery, they are able to sit on the chair with the knee bent to almost 90 degrees or 100 degrees on the next day of the surgery. And patient's pain is significantly reduced now after surgery. Now that makes it like the patient's pain is assessed at 0 to 10 levels. So mostly the patients remain within the level of 3 or 4, which is tolerable pain.
Yes.
And they're able to move their joints very well. Now this all is with the help of the robotic assistance, because of the better alignments, better stability, and minimal damage to the tissues. Now that minimal damage to the tissues obviously will reduce
Pain,
the
swelling.
pain and swelling.
Yes.
Right. So both are controlled in a significant way, and with that our patients do extremely well.
That's really interesting to know that because of the AI is actually helping humans in facing less pain, swelling, they're going to return back to their activities. That's it for this podcast. Thank you so much for meeting me, doctor.
Thank you so much.
Thank you. Thank you.